Can swab tests tell if an STI is active or old? Imagine getting tested for an STI and wondering if the infection is something recent or from long ago. It's a common question, and the answer is a bit more complex than a simple yes or no. Swab tests are a key part of diagnosing many STIs, but they have limitations when it comes to telling whether an infection is active or old. Swab tests work by collecting a sample from areas like the vagina, cervix, urethra, or throat, depending on the infection suspected. These samples are then analyzed using highly sensitive methods called nucleic acid amplification tests, or NAATs. These tests detect the genetic material of the pathogen, such as DNA or RNA, or sometimes specific antigens. When a swab test comes back positive, it usually means the pathogen is present at the sampled site, which strongly suggests an active infection. For bacterial infections like chlamydia or gonorrhea, a positive result generally indicates an ongoing infection that needs treatment. However, these tests cannot tell how long the infection has been there. They detect the presence of the organism at the moment of testing, but they don't distinguish between a newly acquired infection, a chronic infection, or residual DNA from a past infection that has been treated. For example, some viral infections like herpes or human papillomavirus can leave behind DNA that remains detectable even after symptoms have gone away or the infection has become dormant. This means a person might test positive long after they are no longer experiencing symptoms or are no longer infectious. It's also important to understand that a positive swab test doesn't always mean the person is contagious or showing symptoms. Some individuals may have asymptomatic infections that are only found through testing. Conversely, someone might have symptoms but test negative if the infection is no longer present or if the sample was not collected properly. Proper sample collection and timing are crucial for accurate results. Testing too soon after exposure might lead to false negatives if the pathogen levels are still too low to detect. To get a clearer picture of whether an infection is active or old, healthcare providers often use additional information. They may look at symptoms, perform physical exams, review the patient's sexual history, or order blood tests. Blood tests can detect antibodies or immune responses that indicate past exposure or current infection. For example, in syphilis or herpes, blood tests help determine if the infection is active or has been previously treated. In summary, swab tests are excellent tools for detecting the presence of an STI pathogen at the time of testing. They are highly accurate for identifying current infections but cannot definitively tell if an infection is old or new. To understand the full picture, healthcare professionals consider other factors like symptoms, history, and additional tests. If you're concerned about an STI, it's always best to consult a healthcare provider who can interpret your results in context and guide you on next steps. Remember, testing is just one part of managing sexual health, and personalized medical advice is essential for proper care.